So what led me to do my research in this area? Well, up to 18 to 24% of patients presenting to clinic with knee pain have patellofemoral joint osteoarthritis. A majority of these are women. Now, since the first patellofemoral joint replacement was developed, which was in 1955, this was plagued with multiple failures, with up to an 88% risk of revision. However, since then we have noted significant improvements in surgical design and surgical technique, which has stimulated the resurgence of interest in this procedure. Therefore, I wanted to find a way how we as surgeons can optimize our surgical success. What key findings surprised me? Well, that surgeons only need to perform 5 patellofemoral joint replacements per year in order to optimize their surgical outcomes. The study highlights the importance of surgical experience and how it is linked with surgical success. Should practitioners change their practice based on your findings? Well, yes, if surgeons do come across patients with patellofemoral joint osteoarthritis and they have exhausted all conservative treatment measures, then they may want to consider a patellofemoral joint replacement if they do have the optimal surgical experience. What remains the most important unanswered question in the study? Well, one of the commonest reasons of revision following patellofemoral joint replacement is revision secondary to pain. Whether a surgeon is high volume surgeon or a low volume surgeon, pain remains one of the most commonest reasons for revision. And so the unanswered question is, why do these patients get pain after patellofemoral joint replacements?